Good day, everyone. I am Venus Janela, and for us to deeply understand our topic, let me discuss to you first its definition. Senior citizens are also referred to like elderly people or simply seniors. A senior citizen is a social demographic defined by age. Someone over the age of 35, for example, cannot be considered a senior. Being a senior citizen usually means that a person has reached the age when they can no longer work. They are transitioning from being a working adult to being a retiree. A senior citizen is culturally defined as someone who is slowing down in their life. They have raised a family, had a career, or accomplished any other monumental feat in their adult life. Ang elderly or senior citizen ay hindi lang basta sinabing matatanda, ito ay may binabatayan din na edad bago masabing sila ay senior citizen na or elderly. Dito sa atin, ang mga edad 60 pataas ay kinikilala na bilang senior citizen or elderly. Sa edad na 60, ang karamihan ay wala ng sapat na lakas upang makapagtrabaho pa. Mula sa pagtanda sa pagtatrabaho hanggang sa pag-retire nila dito, ganito na ang nangyayari sa buhay nila once na maging isa na silang senior citizen. But as for me, based on my interaction with elders, several of them still continue to work for them to support their daily needs and finances. A senior requires a financial assistance either in the form of retirement funds or savings or with the assistance of a caregiver. Because a senior citizen is no longer able to work, they must rely on someone or some account to help cover their expenses. As a result, seniors are frequently reliant on others for their well-being. Medically, a senior citizen is more likely to have health problems which are more likely to be chronic. Gawa nga ng katandaan at wala na silang sapat na lakas at kakayahan upang magpatuloy pa sa trabaho at kailangan na nilang magretiro, dito naman papasok ang mga pangangailangan nila sa araw-araw, lalo na kung ang isang senior ay wala ng mga anak na tutulong sa kanya. Sila ay nangangailangan ng financial assistance na mas kilalang ang social pension dito sa ating bansa. Ito ay bilang pandagdag sa mga panggastos nila sa pang-araw-araw na pangailangan, lalo na sa kanilang mga medikal na pangangailangan. Gawa nga ng katandaan at wala na silang sapat na lakas at kakayahan upang magpatuloy pa sa trabaho at kailangan na nilang magretiro, dito naman papasok ang mga pangangailangan nila sa araw-araw, lalo na kung ang isang senior ay walang asawa o anak na tutulong at kakalinga sa kanya. Sila ay nangangailangan ng financial assistance na mas kilalang ang social pension dito sa ating bansa. Ito ay bilang pandagdag sa mga panggastos nila sa araw-araw, lalo na sa kanilang mga medikal na pangangailangan. And now, I'm giving the floor to Miss Lumen for her to discuss the characteristics of elderly group.
So let's talk about the characteristic of elderly. The end of one's lifespan is known as old age. The age of 60 is commonly regarded as the threshold between middle and old age because there are such large variances among individuals in the age and better aging actually begins. Chronological age is poor criterion to employ in marking off the onset of old age. Grow older, there is a lot of changes that is happening in our body. So let's talk about ano yung mga katangian na meron ang isang elderly. So first is old age is a time of deterioration which is caused by both physical and psychological reason. So ito nga daw, ang old age daw is a period of decline kung saan umaayaw na yung katawan ng isang tao, not just physically but also mentally. Kung saan may mga pagbabago na din sa pag-uugali natin, madalas na tayong mairita at mas emotionally weak na din tayo that can also cause depression. There are many stereotypes of old people, whether in folklore, the media, poetry, fiction, jokes, or various forms of humor, that they all portray that elderly is physically and mentally worn out. They are calling them na unproductive and alagain na lang at takaw sa disgrasya. And they also said na older people is already weak, that they should step aside to the younger ones. So, there is also a lot of changes in physical appearance wherein kumukubulubot na yung balat and such, but there is not just physical changes but also alteration in psychological function. Kung saan humihina na yung pandinig at panglasa, nagbabago na din yung panlasa sa pagkain, pangamoy, at sensitibo na din sa mga sakit. And mas madali na din sila mapagod compared to the younger ones. Mabagal din yung pagkilos, particularly in writing. Diba napansin naman natin on our grandfathers and grandmother na masyado na sila mahinang kumilos or kailangan pa ng assistant in writing. So, and they already prone in accidents, which is we'll discuss later to the challenges that they were encountering in their daily life. So they said that old folks have weak recent memories but good distant memories. May kasabihan nga yung karamihan na pag pensionado ka na, ibig sabihin senior citizen ka na. So now let's talk about the current situation of the elderly group. So current situation, pandemic affects people of all ages. There is an unheard of sight of vulnerable group of older people around the world in the midst of the current crisis. Elderly age 65 and older and those underlying medical conditions such as cardiovascular disease, hypertension, and diabetes are at higher risk during this pandemic. So since ang mga elderly is mas prone na sila or mas may high risk na sila na makakuha ng COVID-19, mas mahigpit or stricter ang ginagawa sa kanila. So, hindi lang talaga mga kabataan yung naapektuhan this pandemic but also the elderly because hindi na nila magawa kung ano yung mga gusto nilang gawin or it's either especially dun sa mga elderly na sila lang din yung bumubuhay sa sarili nila. It really the pandemic really affect the life of the elderly group. So, for example, the interview of Lola Rosita, who live in Malabon City with her husband Emiliano, who's 81 years of age. So, Lola Rosita is a retired government employee na. She is receiving a small pension from the GSIS or the Government Social Insurance System. Na yung lahat ng pension is napupunta lang sa medicine nilang mag-asawa. And according to her na usually she listen to the reminders on radio such as do not go outside, always wear face mask, and such thing to avoid acquiring the virus. Sinusunod naman nila to, but still, she said that they need to make some sacrifices, lalo na sila lang din yung bumubuhay sa sarili nila. Like, hindi na sila pwedeng pumunta ng labas, hindi na nila magawa yung kung ano yung ginagawa nila dati. And she also said na yung government daw is nagpo-provide ng relief goods for them twice, but it is still not enough. Kasi twice is not still enough for them to live or to survive in their daily life. And she also said na she also worried to the other people like her na walang or inabandonan na ng pamilya kasi older people like her need a medicine to treat their current condition kasi hindi na sila bata para makapagtrabaho pa. So this pandemic really affect and makikita talaga natin how they are affected and how hard it is to live in this world. So yun na nga, and kailangan din kasi nila ng money to buy their necessaries. So, especially that their children cannot go to work. Ito na nga, buti nga kay nanay is meron siyang anak na tumutulong sa kanila, but it's still, because of the pandemic, her daughter cannot go to work. So, she also added na nag-worry siya about the other elderly because until now, hindi pa rin sila nakaka-receive ng social pension from the government. So, it's really affect how the live of our elderly in the Philippines na dapat hindi lang tayo mag-focus sa mga kabataan, sa kung saang problema, but also let's focus on the elderly. Kasi hindi natin alam kung ano yung pinagdadaanan nila because in this midst of the pandemic, mas sila yung pinaka-apektado sa lahat ng antas ng tao sa lipunan, pinaka-apektado sila because they are prone to the risk of na makukuha yung virus. So, if you also watch the documentary of Ted Filon about the elderly, kung saan ipinakita dun yung buhay ng mga inabando ng mga matatanda. And if you watch that, you can see how hard it is na makita silang naghihirap doon. Tinapon na lang ng mga anak nila. Wala na silang, as in, yung love na binigay nila sa anak nila is hindi na suklian sa kanila because tinapon na nga sila, inabandon na sila. Kasi nga daw, there is one lola na nagsabi na tinapon siya ng anak niya kasi inabandon na siya ng anak niya because wala na daw siyang silbi. Hindi na siya makakapag-provide ng pagkain nila. So, ang ano nun, tinapon na lang siya. Hinayaan na lang siya magpalaboy-laboy sa kalsada. So, yung patuloy na paglaki ng bilang ng mga matatanda is nangungulagan din ito ng paglawak ng mga kaakibat na issue na dapat matugunan na dahil yung mga matatanda is bahagi din sila ng komunidad natin. Na yung mga pangangailangan nila ay dapat mabigyan ng kaukulang pansin at malaman ng malalim ang pag-intindi. So yung paggalang sa mga matatanda ay isa sa mga mahalagang kaugalian, ang pag-alaga sa kanila na dapat silang alagaan. Dahil bukod sa pensyon at mga pangangailangan financial, mahalagang bagay rin sa kanila ang kalusugan at pagkakaroon ng tagapangalaga. So, may I call Miss Junella to continue our reporting.
Thank you, Miss Lumen. Challenges. The following are the challenges that the elderly endures. We often do not take notice of our aging population until we begin to age ourselves or see a loved one struggling. But as a society, we can do more to make life easier for our aging population. The first one is ageism and the sense of purposelessness. Many outdated stereotypes about elderly people exist, which can lead to isolation and marginalization in many communities. We can help older people maintain a sense of identity and self esteem by developing innovative ways to involve them in the community through social events. We can also tap into the wealth of knowledge and experience they have, which is critical for the development of society. Stereotypes and discriminations has no age. Sa panahon ngayon, mapabata man o matanda ay nagiging biktima ng mapanghusgang mundo na ating ginagalawan. But we don't need to be one of those people. We should put our feet onto their shoes for us to understand what kind of life they have, lalo na ang mga matatanda o ang elderly na hindi biro ang naging buhay kumpara sa ating mga kabataan at malalakas pa. Magdamayan tayo, yan ang kailangan natin upang mas umunlad ang ating komunidad. The next one is financial insecurity. Unfortunately, the world of career and retirement is not keeping up the same rate as we are living longer. Several elderly folks are eligible and inclined to work past the standard retirement age. However, there are fewer opportunities. In accumulation, managing daily finances and planning for later life can be struggling for the elderly, as extensively online activities are more practiced nowadays. They are vulnerable to any kind of fraud and scams digitally. Nakakalungkot man pong isipin pero gawa ng katandaan kahit na maraming opportunities ang kayang-kaya pa nilang magampanan ay limitado na sa panahon ngayon. Kung kaya't dahil dito nahihirapan silang sustentuhan ang kanilang panggastos sa araw-araw, idagdag mo pa dito ang pagiging vulnerable nila sa mga scam o panlolokong nagaganap online. Another one is difficulty with everyday tasks and mobility. As a person ages, their mobility and dexterity naturally decline, making it more difficult to complete daily tasks. This can gradually lead to people caring for themselves and preventing them from being social, pursuing interests, or participating in activities they enjoy. More assistance is required to enable elderly people to not only live independently through products and programs focusing on safety, balance, fitness, and mobility, but also to ensure they can thrive as individuals. Yes, this is so true. Habang tayo ay tumatanda ay unti-unting nalilimitahan ang ating pagkilos sa paggawa. Kaya nga ang mga senior ay unti-unti na ring nawawalan ng gana sa mga bagay o gawain na noon ay nagagawa pa nila ng buong husay. Challenge ito sa kanila sapagkat isa itong pundasyon sa pagbuo ng kanilang self-esteem, sa pakikipagkalubilo sa iba't ibang henerasyon as well as for them to enjoyingly survive their everyday tasks and not to burden themselves and anyone else. Next one is choosing the best care provider. Many elderly people require additional care when complete independence is no longer possible. Family members can sometimes provide this care, but it can put a lot of strain on the caregiver in terms of balancing this with work and other family responsibilities. These caregivers require training, resources, and emotional support to provide the best care for their loved ones and themselves. In some cases, such as when there are complex medical conditions and or physical disabilities, it is more appropriate to hire a professional caregiver regularly. The elderly person can remain in their own home with the help of a comprehensive elder care services. Habang tayo ay tumatanda, nangangailangan tayo ng mas tutok na atensyon at pag-aaruga. Ako bilang isang apo, naranasan ko ring mag-alaga ng aking lola nung siya ay nabubuhay pa. At masasabi ko pong noong mga araw na inaalagaan namin siya ay lubhang talagang mahirap. Lalo na't may mga responsibilidad din kami bilang anak, kapatid at estudyante. At gaya ng lola ko na isang senior at may sakit, ay nangangailangan sila ng aruga at pag-aalaga na magmumula sa isang professional care provider. Mas maalagaan at matutukanan ng kanilang mga kakailanganin lalo na kung sila ay may mga malulubhang karamdaman. Next is access to healthcare services. Healthcare can be complicated and disorganized for the elderly, especially those suffering from long-term ailments. Coordination of medication and other types of care necessitates the involvement of numerous medical professionals and clinics. Definitely, healthcare services is one of the essentials of elderly, pero ito ay komplikado para sa mga matatanda lalo na kung sila ay may mga malulubhang karamdaman. Lastly is end-of-life planning. We must all prepare for the unavoidable, but death is often a difficult topic to discuss or plan for. Elderly people and their families require assistance when considering end-of-life options, financial implications, and how to ensure that the individual's wishes are honored. Walang permanente sa mundo, darating din ang panahon na ang buhay na pinahiram sa atin ay babawiin din ito sa atin. Ang kamatayan ay hindi natin alam kung kailan darating. Ang mga senior citizen ay kailangan masigurado ang kanilang buhay at kamatayan. Dahil gaya nating kabataan, sila ay nagnanais ding mapagandaan ang kanilang kamatayan na kung sakali man ay ayaw na nilang maging pahirap o alalahanin pa sa may iwan nilang pamilya. And now I'm calling Miss Juarez to discuss the Philippine laws.
Thank you, Miss Janela. So now let's talk about Philippine laws for senior citizens. The 1897 Philippine Constitution, Article 15, Section 4 on the Filipino family states, it is the duty of the family to take care of its older person members while the state may design social security programs for them. It is therefore the responsibility of each family to ensure that the senior members of its household are properly cared for assistant. Filipino people plays an important role in providing assistance and care to older Filipino who need help in carrying out functional activity. Filipino people are not doing this for law, as we family-oriented we remain faithful to our elders as we this assistance and care to them as thanks for what they've done for us through the years. This is a filial duty toward older persons. By the family members on the same family have the duty to render mutual aid, both moral and material, to each other. This is a particular imposed by the Constitution with respect to the care of its elderly members. By the state's existing laws grant benefits for sickness, disability, accident to individuals covered under the Social Security System or SSS. May mga batas na nagbibigay benepisyo at pribilehiyo sa mga nakakatanda at ang mga ito ay matagal nang naipasa at naipatupad. Ngunit may iba pa ding seniors na hindi alam ang tungkol dito. Ang mga benepisyong ito ay defined under the Republic Act No. 7432 as amended by RA No. 9257 and further amended by RA 994 or also known as the Expanded Senior Citizens Act of 2010. Ang elderly Pilipino ay entitled sa 20% senior citizen discount and are exempted from value-added tax or VAT exemption para sa mga angkop na goods and services para sa kanilang eksklusibong paggamit.
Pero saan nga ba ito na-apply? First, sa medicine. Generic man or branded medicine, vitamins and minerals, supplements with doctor prescription. Medical supplements and equipments for hearing aid, eyeglasses, wheelchairs, crutches, dentures, at iba pa. Medical and dental services in private facilities like lab tests such as blood tests, x-ray, and professional fees of attending physicians and licensed health workers. Na-apply din ito sa domestic air and sea travel fares, public land transportation such as jeepneys, buses, taxis, MRT, LRT, and etc. Hotels for accommodation and amenities in hotels, beach resort, mountain resort, and restaurant for food, beverages, dessert, and other consumable for dine-in and take-out. Maaari rin itong gamitin sa recreation centers for mental and other fees like sport facilities such as gyms, badminton courts, ballroom studios, bowling lanes, and for places for leisure like cinemas, theaters, and concert halls. For funeral and burial services, if sakaling na-disease na or namatay na ang isang senior citizen, may 20% discount po para sa hospital more immobling casket or cremation and other funeral services. These are other senior citizens benefits. First, income tax exception for minimum wage earners. Training free exception for social economic programs, free medical and dental services in government facilities, free flu and pneumococcal vaccination for indigent senior citizens, scholarship and financial assistance for senior citizens, education in public and private. Retirement benefits from SSS, GSIS, and Pag-ibig. Discount in special programs for senior citizens. Express lane for senior citizen in all government and commercial establishment. So, paano nga ba nila maaabil ang ganitong benefits? First, senior citizen must have present their senior citizen ID issued by the Office of the Senior Citizen Affairs or OSCA. Pero if sakaling hindi nila dala, pwede rin ipakita ang kanilang government-issued valid ID like passport, SSS ID, and iba pa.
Services of government and non-government organization. COSE is a non-government organization in our country that is working with older persons since 1989. This organization mainly focused on the formation and strengthening of the older persons organization and advocacy and partnership building. Coalition Services of the Elderly Incorporation is a non-government organization which is ang focus niya from the name itself is for elderlies, na itatag ang organization na ito during 1989. COSE's vision is to focus on making and promoting age-friendly society kung saan yung mga older persons are being valued and mapanatiling maayos ang kanilang health conditions as well as ang kanilang seguridad, while the organization's mission naman is to work with elders, especially those who are penniless and hindi na talaga makapagtrabaho. From that, COSE has organized a total of 850 older persons organization in all 21 provinces and cities sa buong country natin. Of course, COSE has their own programs and services as well as their contribution in some other laws related to senior citizens' rights. Una is the social protection. Dito nagbibigay ng pension for older persons, lalo na yung mga wala ng trabaho and kailangan nila ng financial assistance when it comes to their daily necessities and medicines. From also the active and healthy aging. Nagpo-focus sila in ensuring the health of the senior citizens. Yung kasi din yung organizations that contributed in the passage of some policies in response to older people's health needs. Ito yung RA 994, which is the Expanded Citizens Act of 2010. This act grants additional benefits and privileges to senior citizens. Ganon din sa Republic Act 10645 or the mandatory PhilHealth coverage for all senior citizens. This act naman, kaya siya related from this organization because if a person is already senior citizen, they shall be covered by PhilHealth. So imagine if there were a sudden accident, matutulungan sila ng PhilHealth sa gastusin. The next one is the DOH. The Department of Health is the executive department of the government of the Philippines that holds the overall technical authority on the health, as it is a national health policymaker and regulatory institution. Next slide. Healthy and Productive Aging Program. The Healthy and Productive Aging Program, as mandated by Republic Act 925 and RA 9994, focuses on promoting senior citizens' health and wellness and alleviating the conditions of elderly people suffering from degenerative diseases. This program primarily aims to improve the quality of the life for older people and contribute to the development of the country by ensuring fair access to high-quality healthcare. So the next one is the DOH and its program mainly for the elderly. The Department of Health is a government organization who is in charge in ensuring the great quality and services for the Filipino people. Kumbaga siya yung principal health agency ng Pilipinas. When it comes to its program naman for senior citizen, meron din. This is the Healthy and Productive Aging Program. Bilang pagsunod sa RA 9257 and RA 9994, the DOH creates this program. What's the significance of this program? So this program promotes senior citizens' health and wellness. Ini-ensure ng program na to yung mga elderlies natin is secured and their health condition is in good state. Kasi nga, iniiwasan natin na mapabilang sila sa cases wherein they suffer from diseases that are difficult to address or sometimes incurable. They want to provide a good quality of life for older persons at sinisigurado nila na our senior citizens have their fair access when it comes to high quality healthcare. Yung high quality healthcare kasi yun yung care na binibigay that is effective, safe, patient-centered, equitable, and was delivered by our professionals who are respectful and can communicate clearly, as well as hinihingi nila yung desisyon ng mga pasyente. Now, let's tackle the SSS program, the Social Security System. The Social Security System is a financial institution in the Philippines. SSS administrates Social Security benefits for private sector employees in the event of workers' death, disability, illness, maternity, or old age, as well as their Social Security pays a replacement income. The Social Security Act of 1954 went into effect on September 1, 1957. Later that, via the implementation of several legislations, SSS coverage and benefits were increased and improved. So the Social Security System, ito yung financial institution rito sa bansa natin. A social insurance program na ang aim is to provide protection to its members and beneficiaries. Yung mga members niya, they can avail maternity, sickness, disability, retirement, funeral, and death benefits. Pension Loan Program. PLP was launched in September 2018. Pension Loan Program seeks to assist the SSS retirement pioneers in the monetary need and to prevent them from becoming victims of private loan sharks with higher interest rates and taking their ATM cards as their collateral. PLP helps in covering expenses regarding medicines, vitamins, and other health care needs. A retirement benefit is a monetary payment made to a member who is no longer able to work owing the old age, either as monthly pension or a lump sum. So sa SSS, mayroong pension loan program na tinatawag. This was launched in September 2018. This program, tinutulungan niya yung retirement pioneers who needs financial relief and ma-prevent sila na lumapit or mag-loan as well as maka-encounter ng mga private loan sharks. So what is private loan sharks? Ito yung mga nagpapautang na sobrang laki ng interest and they also threaten some borrowers if paid late. Minsan yung mga minsan humihingi pa sila ng ATM cards as their collateral pag walang pambayad sa loan. Meron din dalawang klase ng retirement benefits ang SSS. The monthly pension and the lump sum payment. The monthly pension, ito yung lifetime monetary benefit paid or on regular basis to a retiree. While the lump sum payment naman, ito yung one-time payment to a retiree wherein yung total contribution that is paid by the member will be given back to the retiree. Bahay Kanlungan ni Maria Dominica, Home for the Aged. Bahay Kanlungan looks for needy old ladies who have been abandoned by families who cannot afford to take care for them, as well as those who are found alone on the streets. They are given a place to live, a nutritious diet, and medical and rehabilitation assistance. They are guided to deeper spiritual experiences by the sisters and volunteers. This is a home for the aged that takes care of destitute elderly women who was dropped by their relatives. Inaalagaan at sinusuportahan nila yung mga matatanda. Kinukukop sila rito, pinapakain at sinusuportahan sa pangangailangang medikal. Yung mga sisters and volunteers yung nag-a-assist sa kanila. When it comes to their programs naman, for the elderly, meron silang a case of empowerment handicap beneficiary and the Maria Dominica Polyclinic and Rehabilitation Center. Sa a case of empowered handicap beneficiary, program siya for elderly women. They made crafts using their hands. Sila rin yung nagbe-benefit by this program. And maraming babae na matatanda ang naging beneficiary sa program na ito. While the Maria Dominica Polyclinic Rehabilitation Center, this serve as the polyclinic and family health center as well. It provides daily medical and dental, x-ray and rehabilitation, and other medical assessment examination services na kailangan ng mga senior citizens. This program also established a regular medical or dental missions in distant area at the foot of mountain of Antipolo.
Good afternoon, I'm Princess Ignacio and I'm going to discuss the NGOs that cater to elderly. First, COSE, or Coalition of Services of the Elderly. It is a non-government organization in the Philippines that has been working with senior citizens since 1989. One of their objectives is to improve the well-being of older people by forming partnership with a variety of stakeholders at the local, national, regional, and international levels. So, ang COSE or Coalition of Services of the Elderly ay isang non-government organization sa Pilipinas na nakikipagtulungan sa mga senior citizen mula pa noong 1989, especially the most disadvantaged ones in urban and rural areas in the Philippines to address issues of poverty, exclusion, and invisibility so they may live in dignity. They support community-based services for the elderly, including healthcare, assisted living facilities, age-friendly or meaning providing older adults the best care, and diverse livelihoods and inclusive risk reduction and management. Ang isa sa kanilang mga layunin ay ang mapabuti at maalagaan ng mga senior citizen sa pamamagitan ng pakikipagtulungan sa mga local, national, regional, and international levels. Second, the Kamangawa Foundation Incorporation is a non-government organization established in Manila that works to better the lives of the poor, particularly the aged, disabled, sick, and fatherless. So, ang Kamangawa Foundation Incorporation ay isang non-government organization na itinatag naman sa Manila na kumikilos upang mapabuti ang buhay ng mga mahihirap, lalo na ang mga older people, mga may kapansanan, may sakit, at mga walang tatay. Their vision is to promote excellent health and improve the social, economic, and cultural well-being of underserved people such as the homeless, the sick, widows, disabled people, prisoners, older people, and drug addicts. Kaya naman ang Kamangawa Foundation ay nakafocus doon sa mga tao o sitwasyong nabanggit. At ang layunin nito ay magsagawa ng mga programa at serbisyo na matutugunan ang pangangailangan ng mga mahihirap sa lipunan. Ang ikatlo namang organization ay ang Bukas Palad Foundation of the Philippines Incorporation or BP. It is a non-profit and non-governmental organization that supports children, the elderly, the urban poor, and disaster victims with sustainable development, education, livelihood, and information and communication strategies. Ito naman ay ang isa ding non-government organization na sumusuporta naman sa mga bata, older people, biktima ng kalamidad at mga urban poor na kung saan pinapanatili nila ang pag-unlad, kabuhayan, edukasyon at communication nito. BP contributes back to society by providing a variety of services and programs targeted at assisting people in their overall development. Meron silang education program. They help Filipino children go to school, gayon din ng health programs and livelihood programs. 10,000 families ang halos naabot ng BP sa pagsasabuhay ng Freely We Give, Freely We Receive at sa mga walang sawang pagsisikap ng members nito. Ang ikaapat naman na organization ay ang ANAWIM. It is a small facility for poor and abandoned elderly people founded by Catholic lay preacher Bo Sanchez in Rizal Province, Philippines. ANAWIM Lay Missions opened its doors in 1996 to rejected and abandoned elderly who are roaming the streets. Its purpose is to provide a home, a sanctuary to those poor and abandoned elderly who have nowhere else to go. So, ang ANAWIM naman ay isang maliit na facility para sa mga mahihirap at mga older people na inabandona na itinatag ng isang Catholic lay preacher, Bo Sanchez, sa lalawigan ng Rizal. Ang ANAWIM Lay Missions began serving the rejected and abandoned elderly on the streets in 1996, and their goal is to provide a safe place for the poor and abandoned elderly who have nowhere else to go. So, ang ikalima naman na organizations ay ang Kanlungan ni Maria Home for the Aged in the Philippines. a non-stock and a non-profit organization, Kanlungan ni Maria is a home for the aged in the Philippines, serving to provide true home to all abandoned, poor, sick, and homeless elderly in the country. Kanlungan ni Marie Home for the Aged in the Philippines ay isang room para sa mga matatanda na naglilingkod upang magbigay ng tunay na tahanan sa lahat ng inabandona, mga mahihirap, may sakit at mga walang tirahan ng mga matatanda. One of the closest homes for the elderly in Manila. Their purpose is to provide enough and suitable housing and necessities to the elderly, as well as love, attention, affection, and support in all parts of life in a homey environment. That's all in my part, and thank you.